it's Meenu, and now we are going to continue a new series where we will study human anatomy and physiology, the muscles and all. And today we will discuss about bones and joints of our upper limb. Myself Meenu. So let's see. Bones of the shoulder, girdle and arm, and clavicle, scapula and humerus. We will study these topics today. And clavicle, this shoulder girdle consists of clavicle and scapula, which articulates with one another at acromioclavicular joint. The arm bone is humerus. So here we can see that this is the clavicle bone and this bone is scapula, and here this bone is humerus, that's called also arm bone. And let's go ahead. And clavicle or collarbone, we will discuss about collarbone in detail. So we will discuss here about clavicle. This is also known as collarbone, and this is the one of the bones of shoulder girdle. It is a long slender bone, long slender, that lies horizontally across the root of neck just beneath the skin. Just go and check beneath the skin of neck, palpate there is a cavity type. You already have known about this. This is collarbone because here our collar lies, and this is also called clavicle bone. So let's know some peculiar features of clavicle. It's the first bone to ossify in the body. First of all, let's see about this. Here we can see that this is the right clavicle, and this is how this is the superior view, and this is the sternal notch. This is the sternal notch attached to the sternum here. This is the sternum and this is the sternal notch. And here this is the shaft region. Can you guys see this? This is the costal tuberosity, subclavian groove. Here you can see subclavian groove, conoid tuberosity. Here you can see conoid tuberosity. For deeper study, you guys must know anatomy of the whole body. So we are going to start here. And here you can see this line is known as trapezoid line. Okay, are you guys understanding? And here this one, acromial lateral end. Can you guys see this acromial facet? Both the acromial facets are, yes. And this should be learned by you. Let's see about these features. some features about clavicle, peculiar features. So first feature is just notify what I am saying. These are very important. Clavicle is the first bone to ossify in the body. This is the first bone when we are giving birth, comes into the earth. The first bone which ossifies is the clavicle. Just give me answer, which is the first bone ossifies first in the body? Answer is the clavicle. Okay. Only long bone which ossify from two primary and one secondary center. This is the only long bone in the body which ossify from two primary and one secondary center. Two primary and one secondary center. Just notify these what I am saying. These are very important points. And only long bone in the body lying horizontal. This is notified in long bones. But this is the one and only long bone which is lying horizontally in the body. This point is also to be notable. Okay. And only long bone which ossify from a membrane. This is the bone which ossifies from a membrane known as intramembranous ossification. This is from intramembranous ossification known as. Okay. And only link between the appendicular and axial skeleton. This is the one and only link between appendicular and axial skeleton. Just don't go with my writing because I'm very new to it, so I am unable to write very good, but just listen me and understand my points. And the most common bone to be fractured in children and during birth. Yes, this is also very important point. This is the most common bone to be fractured in children's. This happens very often, very usual, and during birth also. Only long bone subcutaneous throughout. This is from subcutaneous throughout. And it has no medullary cavity. Clavicle has no medullary cavity. So you guys should know this. And the most common site for fracture of clavicle is the junction of middle third and outer third. The most common junction is what of the clavicle? This is the middle third and outer third. Junction of medial 2/3 and lateral 1/3. Could you guys remember this? You should remember. Which is the part? 2/3 and lateral. These should be noted. Okay. And not now, scapula, not now. Let me erase these. If you guys have not noted, just go back to the video. This is for always. And here we will also know muscle attached to the clavicles. Right, a heading is muscles attached to clavicle. Okay, so the muscles, number 1, muscles taking origin from clavicle. Which muscles are taking origin from clavicle? So there is 4 muscles are taking origin from clavicle. First is pectoralis major. Pectoralis major muscle. And the second is sternocleidomastoid. Sternocleidomastoid. I will try to make my writing better. Mastoid. This is D. Third is this, also known as sternal head. This is lying in the sternal head. Sternal head. And the third is deltoid, and this is anterior half. The anterior half of deltoid, also deltoid. Okay. Deltoid, origin from clavicle. Deltoid. What I am doing, I just sometimes I go mad. Okay. And its anterior half. This is anterior half. Oh my god, let me erase this all. Oof. So you guys should remember this all. Okay, I would like, and if you guys are liking this knowledge, understanding, then please write in the comment box. And the fourth muscle is sternohyoid. What is this? Sternohyoid. Just listen, understand, and also note with me. And the second part is muscles having insertion on clavicle. Which muscles are insertion? Insertion on clavicle. This should be रट्टाफाई, कहते हैं ना, रट्टा हो जाना चाहिए. Just go and revise twice or thrice so that this could not erased from your mind. And these are, which which are inserted. Trapezius, just revise with me what I am saying, you also say. Subclavius, and जगह कम पड़ रही है. And the third one is tell me what is third one. There is no third one. Okay. Now move ahead to the scapula. So scapula is a flat triangular bone overlapping second to the seventh rib of the upper part of the posterior lateral chest wall. Which is type of bone? This is scapula. Scapula is a flat triangular bone. Just revise with me, repeat with me. Which type? Flat triangular bone overlapping second to seventh rib. Which rib? Second to seventh rib, and of where upper part of posterior lateral chest wall. Where is this situated? Upper part of posterior lateral chest wall. Just say with me, and let's see this structure. So here you can see this is flat. Which kind of bone? This is flat bone, and triangular. You can see this is triangular type. And this is the coracoid, and this is trapezius muscle attached here, omohyoid muscle attached here, superior angle of scapula here. This won't come to your mind in a first. You have to revise this again and again. Okay. Levator scapular muscle. And here is supraspinatus muscle, rhomboid minor muscle, infraspinatus muscle. Here is the biggest part of infraspinatus muscle. Medial border, rhomboid major, and inferior angle. Here is this is the latissimus dorsi muscle. नाम कैसे कैसे हैं, किसने रखे थे? Teres major muscle, lateral border, teres minor muscle, triceps. These are triceps. Scapular neck, glenoid fossa, deltoid muscle, and this is the acromion. Here is the coracoid tendon of coracohumeral and biceps. This is the pectoralis minor muscle. Here is the scapular notch, and this is the omohyoid muscle, and this is serratus anterior muscle. This is the subscapularis muscle. This is the subscapularis muscle. So have you guys understand something? You have to revise this again and see this picture again and again. Take an screenshot, then this will fit is mind. Okay, now let's see some features of this. Inferior angle overlaps 7th rib or 7th intercostal space and lies opposite to tip of T7 spinous process. This is very important, also come in DNB and PGI questions also. Inferior angle, just note points with me. Inferior, what I am saying, just note this. Angle overlaps 7th rib or 7th intercostal space. Which rib or intercostal space is the 7th and lies opposite to the tip of T7 spinous process. Lies opposite to the tip of which T7 spinous process. Okay. And the second point is superior angle lies opposite to the T2 spinous process. Now with the superior angle, this lies opposite to the tip of T2 spinous process. And lateral angle corresponds to the glenoid fossa. Third one is lateral angle, and this corresponds with the glenoid fossa. Okay. Let me erase this now. Okay. And the fourth point is here. Junction of medial vertebral border corresponds to tip of T3 spine. Junction of medial also known as vertebral corresponds to the tip of T3 spine. The medial border inferior angle part of the lateral border of scapula can be palpated on a patient's can be the spine. Just go and palpate to yourself or another person or any patient. Just touch it and you will feel medial border, inferior angle and part of the lateral border of the scapula, and as can the spine and acromion. The superior border and angle of the scapula are deep to the soft tissues, which are deep superior border and angle of scapula are deep to soft tissue and not readily palpable. These are not palpable. Okay, let's see some other very important points also. If you want to be perfect, then study perfect. Triangle of auscultation. There is a term triangle angle of auscultation, and this is bounded by trapezius, latissimus dorsi, and medial border of scapula. Border of scapula. This lies just medial to lower half of medial border. This lies when just half medial to the lower half of medial border. Congenital high scapula is known as Sprengel's deformity. There is a congenital high scapula is also known as Sprengel's deformity. It is due to failure of normal descent of scapula during development. What this known as is Sprengel's deformity. And we have to study now muscles attached to the scapula. Which muscles are attached to the scapula? We have read muscles attached to the clavicle, and now we have to study muscles attached to the scapula. These are coracoid process. First of all, coracoid process. Coracoid process. This is the tip of coracoid process, gives origin to coracobrachialis medially and short head of the biceps laterally. From here, a muscle takes origin known as from the head of or tip of the coracoid process, gives origin to the coracobrachialis. Coracobrachialis, and this is medially just notify this. I am trying better for you. And short head of the biceps, short head of biceps laterally. Okay, so now we have to see the upper surface receives insertion of pectoralis minor. In the upper surface there is the insertion of a muscle, that is pectoralis minor. And what I am saying also listen to me carefully and note it down into your notebook. Just listen me very attentively. spine of scapula and acromion process. And the second point is spine of scapula and acromion process. There is a origin of deltoid and insertion of trapezius. Here is the origin of deltoid muscle. Here is the D, just make, yeah, okay, and insertion of trapezius. I'm just saying, you just note it down, trapezius. And let's move ahead to the glenoid tubercle. Let me point out this first for you so you guys could note this. This is the heading, and here is the origin of deltoid and insertion of trapezius muscle. Just note it down. And third one is glenoid. This is the glenoid tubercle, and here supraglenoid tubercle gives origin to the long head of biceps muscle, and infraglenoid tubercle gives origin to the long head of triceps. So here is the two parts, supraglenoid and infraglenoid, and supraglenoid gives rise to the gives origin to the long head of biceps. Let me change the color. Here is the origin of long head of biceps, and this one infraglenoid tubercle gives rise or originates to the long head of triceps. Long head of triceps. Now let's see its. Now we have to see its lateral border. We have to make some another space. Now lateral border. Lateral border. Origins of teres minor and teres major muscle. From here the origin of teres minor and teres major muscle. Okay, let's move to the medial border. medial border, and insertion of serratus anteriorly and rhomboidus major, rhomboidus minor, and levator scapulae posteriorly. Here is 4 types of muscles. There are insertions. First, serratus anterior, insertion of serratus anterior, and this is anteriorly. And second one is rhomboidus major, rhomboidus major, and minor also, minor both, major and minor both, and levator scapulae. These are the second and third, and here is the fourth. Levator scapulae, and this bone is posteriorly, ठीक है. And now we have to see costal anterior surface origin. Which border we have to see? Costal anterior surface origin. Which muscles are originates from costal anterior part? So the next heading is costal. This is the anterior, and surface, costal surface, and here we will see origin. So the origin of from here is subscapularis muscle. Just note it down. And now dorsal surface. Next point is dorsal surface, and origins. Which are origins? Supra-spinatus, infra-spinatus, and at inferior angle latissimus dorsi. So these are, first one is supra-spinatus, and the second one is infraspinatus, and the third one is inferior angle latissimus dorsi, muscle. Okay, so this is done, and now we have to see some movements of scapula. Just put a heading, movements of scapula. Next heading is this movements of scapula. So here is elevation, depression, protraction, retraction, forward rotation of inferior angle, backward rotation. So overall there is 6 type of movements of scapula. So just make a chart. So this is how it goes. No, this type, this won't work. So the first one is movement of scapula is elevation. And which muscles are included in this movement are trapezius, upper part, and levator scapulae. Trapezius, its upper part, and levator scapulae. And the second movement is depression. Here pectoralis minor and serratus anterior muscles are included. Which muscles are included? Pectoralis minor and serratus anterior. Let's see another movement, that is protraction. Third one is protraction. And here the muscles are included: serratus anterior and pectoralis minor. Here is the serratus anterior muscle and pectoralis minor muscle. And fourth one is retraction. Which movement of scapula? Retraction. And here the muscles included: rhomboidus major. This is also important, so just note it down. Rhomboidus major and rhomboidus minor. Rhomboidus minor and trapezius also. Trapezius muscle also included. Okay. And let's move ahead to the forward rotation of inferior angle. The next heading is fifth number, forward rotation of inferior angle. rotation of inferior angle for overhead abduction. This is for what? For overhead abduction. Okay, just write it down. And the muscles included in this: trapezius, upper fibers of trapezius, upper fibers, serratus anterior, lower fibers. And the sixth point is backward rotation, which includes scapula. Sixth movement of the scapula is what? Backward rotation. Just write it down. And this includes levator scapulae muscle, levator scapulae muscle, and rhomboids major and minor. Rhomboids major and minor, both of these muscles included. Okay, so we are done with scapula. Let's move ahead to the humerus. So here you guys can see, this is the head of the humerus. Humerus also known as arm bone. Here is the greater tubercle. This is the radial groove. Here is the olecranon fossa. This is the lateral epicondyle. This is the medial epicondyle. How we decide lateral and medial epicondyles? Just go and see your body. Just make your hand apart and part away from the body. There is two sides, away from the body and towards the body. Which is the away from the body is lateral side and towards the body is the medial side. So the towards the body is medial condyle. Just feel your arm, and there is another side away from the body is known as lateral side. Here is the lateral epicondyle. Just feel it and see in the image. And here is articulates and head up. This is the head of radius. Okay, so this is the anatomical neck. This is the surgical neck. This is the body and shaft. Deltoid tuberosity, lesser tubercle, greater tubercle, intertubercular bicipital groove. Here is the lateral paracondylar ridge, radial fossa, coronoid fossa, capitulum, head of radius, trochlea. This is the trochlea, and this is coronoid process of ulna. We are not studying here ulna. This is in the picture, so I am telling you. This is the anterior view and this is the posterior view of the humerus. Okay, and this is the right humerus. Let's move about its some features. Humerus is the arm bone which articulates with the scapula and the shoulder joint. It articulates with the scapula bone and shoulder joint and with radius and ulna at elbow joint. This is the elbow joint, and here upper part would be shoulder joint where scapula and clavicle articulate, and here we can see radius and ulna articulating here, and this is making elbow joint. Okay, humerus is divided into three parts: proximal end, shaft, and distal end. Near to the body part is known as proximal end, and this is the proximal end, this is the shaft, and this is the distal end. Not this, not this, this is distal end, shaft, proximal end. So let's study about the proximal end. The upper end, known as proximal end of humerus, has a head. There is a head, we have seen this, and which is separated from greater and lesser tubercle by anatomical neck. This is separated by which anatomical neck? So where is the anatomical neck? This is the anatomical neck, and this is separated by greater, and here is the lesser tubercle. Okay, so now surgical neck separates proximal end from the shaft. This is the surgical neck. This separates proximal end to this from the shaft. This is the shaft, and from here this is the proximal end. So enter tuberculous sulcus. Bicipital groove is sulcus that separates greater and lesser tubercle. Now you can see at the upper end of humerus is the growing end. This is the upper end of humerus is the growing end. Attachment on proximal end are greater tubercle on or tuberosity, insertion of supraacinatus, infraacinatus, and teres minor. In the proximal end there is the insertion of bones, or just note down, these are in the greater tubercle. First one is the insertion of supraacinatus muscle. Supraacinatus muscle. And second one is infraacinatus muscle. Infraacinatus muscle. And the third one is teres minor muscle. And in the lesser tubercle, this is the step point, you can say it a bullet. in the lesser tubercle or tuberosity, insertion of subscapularis muscle. Here is the insertion of subscapularis muscle. Right. Okay. Now let us know some very important things about shaft. Shaft of humerus is cylindrical in upper half and triangular on cross section in the lower half. Here we can see in the upper half it's cylindrical and triangular in the lower half. The upper part has intertubercular sulcus, bicipital groove anteriorly. Bicipital groove contains long head of biceps with its synovial sheath and an ascending branch of anterior circumflex humerus artery. Middle third of posterior surface of shaft of the humerus has a spiral groove, radial groove, which contains radial nerve and profunda bronchi vessels. Attachment to the shafts are, just write it down, which attachments are with the shaft. Number first is insertions. Here is the pectoralis major on lateral lip of bicipital groove, latissimus dorsi. Second is latissimus dorsi on floor of bicipital groove. Third one is teres major on deltoid tuberosity and coracobrachialis, and the fourth one is coracobrachialis medially on mid shaft. This is medially on mid shaft. These were insertion, and now we will see about origins. Here is the origin of brachialis muscle. Number one, brachialis. This is in the anterior surface and lateral and medial head of triceps. Second, lateral and medial head of triceps. These are posterior surface, and the third one is pronator teres, from medial supracondylar ridge, and then the fourth one is fourth one is brachioradialis, which is brachioradialis. So brachioradialis from lateral supracondylar ridge and Fifth one is ECRL from lateral supracondylar ridge. This is from lateral supracondylar ridge. And now let's study about distal end. Distal end, lower end of is enlarged transversely to form condyles medial and lateral. Here you can see this is transversely enlarged to form medial condyle and lateral condyle, which consist of articular and non-articular parts. Articular part includes laterally capitulum articulating with head of radius and medially trochlea articulating with trochlea notch of ulna. Non-articular part includes three fossa, radial, coronoid and olecranon, and medial and lateral epicondyles. From the medial epicondyles gives origin to the which bones from the medial epicondyle gives origin to the superficial flexors of forearm. Common flexor origin. Flexor flexor. Okay, common flexor origin. And front of lateral epicondyles gives origin to the superficial extensors of forearm. Superficial extensors of forearm. Common extensors origin. Common extensor origin. And the posterior surface of lateral epicondyle gives origin to the anconeus. Posterior surface of lateral epicondyle gives origin to the anconeus. Okay. The capsular ligament of elbow joint is attached to the lower and along a line that reaches the upper limits of the radial and coronoid fossa anteriorly and of the olecranon fossa posteriorly, so that these fossa lie within the joint cavity. Medially, the line of attachment passes between the medial epicondyle and trachea. On lateral side, it passes between the lateral epicondyle and capitulum. Thus, medial epicondyle and lateral epicondyle are outside the capsule. Posterior surface of medial epicondyle has a groove lodging ulnar nerve. Medial epicondyle of humerus is sometimes called as funny bone. Which is the funny bone? Funny bone. So posterior surface of medial epicondyle has a groove lodging ulnar nerve. Medial epicondyle of humerus is sometimes called a funny bone because gentle tapping of it results on tingling sensation due to stimulation of ulnar nerve. So next part will come soon. Our today's session has completed. So see you soon. And let me just a minute. Let me complete the ossification of these bones also. Just a few minutes. The humerus ossifies from one primary center and seven secondary centers. Primary center humerus ossify from one primary center and seven secondary centers. Primary center is for shaft diaphysis and appears during 8th week of intrauterine life. The upper end ossifies from three secondary centers, one for head first year and one for greater tubercle second year and one for lesser tubercle fifth year, and these three centers fuse together during 6th year to form one epiphysis, which fuses with shaft during 28th year. The lower end ossifies from four secondary centers, which form two epiphyses. The center includes one for capitulum and lateral flange of trachea first year, one for medial flange of trachea ninth year, and one for lateral epicondyle 12th year. All three during 14th year to form one epiphysis, which fuses with shaft at 16th year. The fourth center for medial epicondyle appears at 4th to 6th year, forms a separate epiphysis and fuses with shaft during 20th year. So finally it's done, and let's see some summary. Is surgical neck is related to the posteriorly to axillary nerve and posterior circumflex humerus artery. Thus these structures may be damaged in surgical neck fracture. Most commonly injured nerve is in fracture that soft humerus is radial nerve. Nerves related to humerus are axillary nerve, radial nerve, and ulnar nerve. Behind medial epicondyle, tennis elbow is lateral epicondyle and golfer's elbow is medial epicondyle. So thank you. Bye bye. Like, share, subscribe. See you soon.